What's up? This is Dr. Taylor Krick, host of the Autoimmune Doc podcast. This is my YouTube channel where I review scientific papers from the peer-reviewed literature, talking about autoimmunity, but talking about the mechanisms and some of the things of autoimmunity and chronic and complex diseases. So on my podcast, I talk about a lot of things pretty quickly. On here, it's going to be the evidence that's out there in the literature backing up and confirming what I talk about. I have a ton of studies on my computer, and I love reviewing science and literature. So today's is a good one. I'm not going to go through an actual paper. I'm just going to skim kind of the table of contents because there's so much to it. So this says the association of other autoimmune diseases in patients with thyroid autoimmunity. So again, in my podcast, a lot I talk about autoimmunity, of course, and a common theme of autoimmunity is that when you have one, you often have others. So a lot of times somebody comes into me with thyroid autoimmunity and there's a likelihood that they have others and they don't know it, or they don't know why they have these other unexplainable symptoms. So even just this week, I know that I've worked with people, this is off the top of my head, with Hashimoto's and rheumatoid arthritis, Hashimoto's and infertility. So who knows if that's another autoimmune process or not, but another, certainly condition. Hashimoto's certainly associated with infertility. Somebody with Hashimoto's and Addison's, Hashimoto's and celiac, and the list goes on. So all I'm going to do is read again the table of contents of this because this is a collection of papers. It comes from Frontiers. And if you don't know yet, if you've never watched this, this channel much, I love Frontiers just in general. I subscribe to several different Frontiers. It's open access, it's free, and it's just, I like it in general. So this is a research topic. There are a number of papers in this. So let's see, where's the table of contents? So I'm just going to read through this. So first off, an editorial talking about the association of other autoimmune diseases. The next is some of the epigenetics that are associated with autoimmune thyroid diseases. Then we get into, here's a connection that we see a lot, Hashimoto's thyroiditis and autoimmune gastritis. So that's really, really common. Now what that presents as is somebody that might get stomach pain, or a lot of times in my office it seems like there are people that remember getting a lot of stomach pain even in their teen years, and then it kind of went away, or they used to get bad stomach aches. And this is gastritis. Autoimmune gastritis can occur through two different mechanisms: autoimmunity against parietal cells, which release intrinsic factor and hydrochloric acid. And then that's going to lead to reflux, that's going to lead to anemias or low iron and things like that. Or autoimmunity can attack intrinsic factor, which absorbs B12. So a lot of times these people will have iron deficiencies, B12 deficiencies, and they might have stomach pain as well. So that's common in Hashimoto's. Vitiligo. Vitiligo is another one. This is commonly known as Michael Jackson's disease. So this is a skin depigmentation disease. Thyroid autoimmunity and lichen planus is often in or around the mouth, and it's kind of a plaquey, itchy skin autoimmunity. Psoriasis, so a very, very, very common one. Psoriasis, there's psoriatic arthritis on here as well. So psoriasis, psoriatic arthritis, and thyroid autoimmunity, common thing. Autoimmune thyroiditis and myasthenia gravis. This is an autoimmunity that attacks the muscles. Autoimmune thyroiditis and glomerulopathies. So autoimmune thyroid disease is associated with things that affect the kidneys, things that damage kidneys, and this can be measured on labs through things like BUN and creatinine, but also the glomerular filtration rate, the GFR, EGFR. So sometimes I'll see somebody again with maybe Hashi's and their GFR will be, 70 and they're, 38 years old. It's like, wow, what's going on with your kidneys? They're not filtering things maybe as fast as a typical 38-year-old. And it just begs the question. It doesn't grant a diagnosis, but it begs the question of what other mechanisms are involved with this. The association of Sjogren's and autoimmunity. Sjogren's will attack like the eyes and the mouth. You get a lot of dry mouth, dry eyes. You also get a lot of profound fatigue. Sjogren's is in the kind of in the lupus family. Systemic sclerosis and thyroid diseases. Lupus. Here's your lupus and thyroid autoimmunity. Here's thyroid autoimmunity and antiphospholipid syndrome. That's a little bit more obscure autoimmunity, but we do detect it because it's on Cyrex's Array 5, which I run. But again, not a lot of people know about that, but it says not such a trivial association. So thyroid autoimmunity, antiphospholipid syndrome, both major causes of recurrent miscarriage and infertility, due to that. But yeah, sarcoidosis and thyroid autoimmunity. Now this one's interesting. Autoimmune or inflammatory syndrome induced by adjuvants and thyroid autoimmunity. So this is it's called ASIA, ASIA, and it's like somebody gets a hip replacement and their immune system is attacking that, and then they develop autoimmune disease. Or somebody gets a vaccine and an adjuvant, and that stimulates an autoimmune disease, but it was induced by adjuvants, and there's an association with thyroid autoimmunity. Yehuda Schoenfeld, he's Israeli. He's one of the godfathers of autoimmune disease here. Thyroid autoimmunity and function after treatment with biologics in RA. So talking about the association between thyroid autoimmunity and RA, but then getting more specific after treatment with biologics. The daily consumption of Coca-Cola, or of cola, no brands, can determine hypocalcemia, a case report of hypoparathyroidism, blah, 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 yeah, whatever. Autoimmune abnormalities of postpartum thyroid diseases. So that's really interesting. We see that often of, autoimmune disease. There's 3 times, especially in a woman's life, where autoimmune disease will flare. Puberty, pregnancy, and perimenopause. And pregnancy is one that's common when people come in and they say, boy, after my first kid, I was tired and I was, run down. But boy, after my second kid, things really change and this is different. And that could be an exacerbation of a thyroid autoimmune condition. Some people will also say, boy, while I was pregnant, I could eat gluten, I could eat dairy. They didn't affect me. I felt great. And so they took advantage of that, and they may have, flared some underlying mechanisms. But the immune system shifts during pregnancy for obvious reasons, to provide protection to the baby. And then post-pregnancy, it shifts again because the baby is no longer part of your bloodstream, but now the baby's getting its antibodies and things through breast milk. So anything that shifts the immune system rapidly can induce or exacerbate autoimmune disease. Postpartum mood disorders, so postpartum depression, postpartum anxiety, and thyroid autoimmunity, increased prevalence in that population. And then thyroid involvement in Hep C virus-infected patients with or without mixed cryoglobulinemia. So cryoglobulinemia is like these proteins aggregate in your bloodstream, and when they get cold, they clump together, and then you get like hypercoagulation or hypoxic symptoms. But in Hep C, so obviously affecting the liver and then leading to mixed cryoglobulinemia. So, interesting things. Again, I'm not going into each of these papers, and I'm not going to. Maybe I will at some point. Like, some of these are pretty interesting, like the postpartum mood, things like that. But my point was just to skim the table of contents, because I think there's enough stuff just by reading these titles to know that these are all very, very common associations with autoimmune thyroid disease, the most common autoimmunity in the world.